As usual, only the best available science on this channel. Today I want to discuss a test that not many people know about but is probably the most accurate and best test of your health status you could ever take. It accurately predicts if you have a buildup of plaque on your arteries, your cancer risk, cardiovascular risk, likelihood of a heart attack, and even risk of dying. You're probably thinking, what about an MRI scan? Well, we chose this test because apart from being relatively cheap and easy to access for anyone, the amazing thing about this test is that it can pick up your risk factors way before you even get symptoms or disease progression or those signs that would normally show up on an MRI scan. So what that means is you can predict your health status and change it before you even get unwell, or early on in illness when you can change the prognosis. So let's get to how the test works. Then I'll tell you exactly how to interpret the results, and even better, what to do if your test result shows a high-risk marker. There is consistent and strong evidence that levels of inflammation in the body are an accurate predictor of all-cause mortality. The reason is most illness, disease or infections are associated with a relative rise in inflammation in the body. So if you had a test that was sensitive to even small changes in inflammation anywhere in the body, this would be an amazing way to pick up diseases like cancer sooner. And yes, there is a test. It's called the high-sensitivity C-reactive protein test. Even plaque formation in your blood vessels causes an increase in C-reactive protein. The test is so sensitive that if you have a history of a specific disease like cancer or heart disease, a high result means you can get tested earlier before the disease progresses, which is amazing. Of course, if you get a low result, then you can be very happy in the knowledge that your health is in top shape. So I'll get to the optimal health score, which is highly predictive. But let's look at high risk first. A score of over 3 milligrams per liter is high risk and would require further testing. For example, if you had a family history of cardiovascular disease, then you would have to get this investigated, as this test is so sensitive to cardiovascular issues. The same with cancer. If you want to use this high-precision test effectively, then even an average risk score between 1 and 3 milligrams can serve a risk enhancer marker, regardless of baseline family history or risk factors. Anyone with this score would benefit from an intensive anti-inflammatory lifestyle to reduce risk. Low risk is, of course, below 1 milligram per liter. However, for an optimal health prediction score, you should be scoring 0.5 milligrams or less. The low-risk score is highly predictive and shows you are in optimal health and least likely to die from all-cause disease mortality. So that's it. Please give us a like if you enjoyed the video, and thanks for listening.